Okay, today's skill is catheter care. You're going to need some supplies. We're going to need 4 washcloths, 2 towels, 2 chucks, and a bath blanket, 2 pairs of gloves, a bath basin, and soap. I'm going to go ahead and get the skill started.
Come in.
Hi, Mrs. Johnson. My name is Lori. How are you today? The doctor has ordered us to get you some do some catheter care on you, okay? Get you nice and fresh. Is that good for you today?
Yes, it's okay.
Perfect. Let me go ahead and check your ID bracelet. What is your name, please, and your date of birth?
My name is Susan Gonzalez. The day of birth is January 1st, 1972.
Perfect. I'm going to go ahead and gather my supplies, and I'll be wash my hands, and I'll be right back. I'm going to provide privacy.
Okay.
I would wash my hands. I would grab my supplies. Okay, I would open up my chuck to protect all of my supplies. I would grab a bath basin and some soap. Okay, I would go ahead and get some water. We want the temperature to be around 105 to 109. Go ahead and test it with our wrist to make sure we're at an optimal temperature. We want to fill the basin at least halfway full. Okay, Mrs. Johnson. Let me go ahead and take your call bell from you. Could you go ahead and test the water for me?
Okay.
Feels good?
Yeah.
Perfect. Okay, I'm going to go ahead and raise your rail over on this side so for safety purposes. Now I'm going to go ahead and raise your bed. Okay, we want to make sure that the bed is around waist height so it is in a good position so we have good body mechanics. Go ahead and put on my gloves. Okay, I would put my washcloths into the water, let them start soaking. Okay, Mrs. Johnson, I'm going to go ahead and open up the bath blanket. This is going to provide maximum privacy for the patient when we're doing this procedure. We're going to go ahead and take down the top sheet so that it does not get wet or dirty. Tucking it at the end of the bed so it's not on the floor. Okay, we're making sure that there's no kinks. We're going to go ahead and roll our chuck. Mrs. Johnson, if you could go ahead and move towards me. I'm going to hold you on your shoulder and your hip, help you. Okay, I'm going to go ahead and cross your feet. You could go ahead and move this arm up. And this one over. And on the count of 3, we're going to turn. You ready? 1, 2, 3. Good, Mrs. Johnson. Okay, we're going to go ahead and place the chuck between the hip and the knee. You're going to feel a little tucking, Mrs. Johnson. That's just us getting the chuck underneath you. Okay, you can go ahead and roll back on the count of 3. 1, 2, 3. Perfect. Go ahead and center yourself. Great. Okay, you can put this arm down. We're going to put this arm up. We're going to change the direction of your feet. Before you change your feet, we're going to have you scoot a little towards us. Good. Put your feet together like that. Perfect. And on the count of 3, we're going to turn. You ready? 1, 2, 3. Perfect. You can hold on to the guardrail for me. Good. Okay, you can go ahead and come back down. Awesome. And you can just center yourself for me, please. Perfect. Okay. To the side. Okay, Mrs. Johnson, I'm going to go ahead and undo your feet here. I'm going to only expose what is necessary. Okay. I'm going to go ahead and push your gown up underneath the bath blanket. Okay. I'm going to go ahead and put a towel here. Okay. Laying the catheter over. Okay. You want to have your washcloth into a 4 corners. And you're going to soap all 4 corners. And then the 5th corner is on the back. Okay? You're going to go ahead and grab the catheter at the meatus, put your washcloth underneath, and slightly pull, cleaning it. That's 1, 2, 3, changing on each corner, 4, and in the back is 5. This is discarding. Now we're going to do the same thing with rinsing. All 4 corners. Okay, Mrs. Johnson. We're going to do 1 and change. And we'll do 2 and change. We're going to do 3, change, 4. Okay, and discard. Now let's go ahead and dry your catheter for you, Mrs. Johnson. Perfect. Okay, Mrs. Johnson, we're going to go ahead and clean your perineal area now. We're going to do the same type of thing, soaping all 4 corners. 1, 2, 3, 4, and we're going to soap the 5th corner on the back. Okay. Now we're going to move the catheter out of the way since it's already been cleaned. You're going to use your fingers to open up the vagina, and you can go down the center and change. Down the inside fold and change. Down the other inside fold, then change. Then down the skin fold and change. Down the other skin fold and discard. And we're going to rinse the same exact way, all 5 corners. Okay, again, opening the vagina down the center and change, down the inside of the lips and change, down the other side of the vagina inside and change, down the skin fold and change, and then down the other skin fold. Perfect. Okay, Mrs. Johnson, I'm gonna go ahead and pat you dry. We're all done. Okay, perfect. Let's go ahead. Okay, Mrs. Johnson, you could go ahead and scoot towards me. Okay, go ahead and lift this arm. Okay, go ahead and put this one on this side. Go ahead and cross your feet. Okay, and on the count of 3, we're going to go ahead and turn. You ready? 1, 2, 3. Perfect. Go ahead and hold on there. You're going to feel a little bit of tucking again, Mrs. Johnson. Okay, back down. Go ahead and center yourself. Awesome. Okay, go ahead and pull up the rail. Come on this side. You go ahead and scoot towards me. Okay, perfect. Go ahead and put this arm up. Cross this arm over. We're going to change the direction of your feet. Okay, go ahead and turn for me. Perfect, Mrs. Johnson. Okay, and back down. Go ahead and center yourself for me. Perfect. Okay, this is where I would change my gloves. Get a new set. And the reason why I do this is because I just was in her private area and I don't want to be using those gloves to pull up her clean sheets. Okay, I'm going to go ahead, pull up your clean sheet. Okay, Mrs. Johnson, pull down your bath blanket, move that for you. I'm going to go ahead and lower your bed, Mrs. Johnson. I would check to make sure that the catheter is free flowing, that there's no nicks, no kinks, or anything blocking it. Okay. I would throw away my dirty linen. I'm gonna go ahead and dump my water. We're gonna rinse it 3 times. Okay, if we had some bleach or detergent, we would squirt it in here now. If not, we would just clean the inside, clean the outside. Filter with this, grab another one. Okay, throw these away. Paper towel to pick up this. Put it in the drawer. Clean up my area. these gloves. Okay, Mrs. Johnson, is there anything else I can get for you?
No, everything is okay.
No? Would you like another blanket?
No.
No? Would you like a glass of water?
No, thank you.
How about an extra pillow?
No, ma'am.
No? Would you like your curtain open or closed? Okay, Mrs. Johnson. Go ahead and give you your call bell. Okay, here's your call bell. My name is Lori. If there's anything else that you need, please give me a call, okay? Okay, Mrs. Johnson. I'd wash my hands. Skill complete.